1 million, plus 3 million suspected undiagnosed in the UK, 30 million in North America, and probably the same in the EU, and that's just the West. The burden on health service is immense. Third largest cause of emergency hospitalizations, I'm told. And it's a huge burden on individuals, their families, and society overall. So it makes sense that anything that can have a positive effect on this situation has to be good news. Well, I've got some. The good news is ibe.mapp. It's an app for mobile devices. And ibe.mapp will deliver improved well-being, better patient engagement, and improved compliance with medication. And it's lack of engagement and compliance that makes it so easy for people to fall into lethargy, despair, and depression, adding to the problem in so many ways. And I'm told authoritatively, pharmacists only issue on average 10 of the 13 expected prescriptions for patients each year. So many are not even taking their medications, and ibe.mapp will have an effect right there. It'll have a positive effect on wellness, drug waste, improve dialogue with clinicians, free up valuable GP time and hospital beds. It delivers prudent healthcare. So let me tell you how this has come about. I started to keep a detailed diary of peak flow readings. I then expanded this with my medications, the changes in my medications and dosages, and then began to score my wellness each morning across several domains. Breathlessness, asthma attacks, nasal conditions, infections, coughing, exercise, sleep, and sleep is so important. And of course my peak flow readings and other related, age-related issues I won't go into. So these are my meds, not untypical, and this is an example of my diary sheet. It looks complex, but only takes 20 seconds morning and evening to do this while I'm taking my medication anyway, ticking boxes, rating 1 to 5. And the results were soon impressive. I could see relationships, I could see correlations. I started to confront my condition twice a day. And now when I see a specialist and he asks how it's been for the last few months, the answer isn't not too bad. I can tell him exactly how it's been and why. I've got a far better engagement with my condition. I can give my GP and specialists real feedback, real data. And of course you can see where all this is going. I might be a bit of a dinosaur, I'm well into my 70s, but even I could see that this was crying out for some technology. An app with user-friendly front ends to suit the various generations, and a secure data management back end. Personalized for each condition by the pharmacist, the chest nurse, or the doctor. The patients themselves will become more engaged with their condition as they see the results building up. And they can take that report into their doctor and have the same meaningful conversations as I did. And the next step's obvious too. Give my doctor or the community pharmacist the ability to see my data 24/7 online. Give professionals the opportunity to examine their entire patient cohort at any time and see how we're doing. Do we need that scheduled review? Or can it be skipped because I'm doing okay? Is that new drug working? Am I taking my drugs regularly? Am I exercising? Does the doctor want to increase the puffs of an inhaler? He can tell me with a message if he so chooses, because the system is two-way. Options for support messages and education. We can motivate smokers with education and YouTube links. And here's another thing. If my peak flow readings are starting to fall off a cliff, as they did here, and my sleep interruptions are up, the alarm will be sent out, bells will ring. The doctor can deal with the situation before it becomes an emergency with ambulances, A&E and hospital beds involved. Then, let the system capture ambient data as well. Temperature, air quality, pollen for each area, all very significant for lung conditions. Aggregate the lot, anonymize, big data, make it accessible to health services and researchers. And it's for all of these reasons and the personal benefits to the patients that the British Lung Foundation have taken a serious interest in this project. The system is easily scalable to allow other e-health services to be bolted on, addressing migraine, early intervention mother and baby programs, diabetes, prostate. So, ibe.mapp really is good news.